For malignant pleural mesothelioma, the tests that a patient would undergo, to arrive at a diagnosis is the first thing is usually a chest X-ray, and then from the chest X-ray, quite a bit of time, patient will have accumulation of fluid in the pleural space. It's called a pleural effusion. Once and pleural effusions, will cause the difficulty with shortness of breath. They'll also cause difficulty with, exertion. You'll be short of breath. You'll be just generally uncomfortable and feeling like that you just can't take that deep breath that you normally can. Your exercise tolerance will be down, and you just won't feel right. So usually the next step for that is that you'll have your lung tapped, called a thoracentesis, where they remove fluid from your lung. After that, they test the cells, although that's not. They test the cells of the fluid, and then they'll just further watch you. What happens quite a bit of times is the fluid reaccumulates, and you repeat that procedure. A lot of times, too, patients go on antibiotics for 10 days for a presumed pneumonia, and then what happens is it doesn't get any better. So they return again to the physician, and they continue, and then you might go through this series maybe once, maybe twice. Maybe it will take 6 months from the start of your symptoms to put it all together towards a diagnosis of malignant pleural mesothelioma. There's lab work done, there's blood drawn to see if you're elevated white count, to see if it's an infection. There's culture and sensitivity from sputum to see if it's, again, an infection that could be causing all of this. There's blood work, there's x-rays, sometimes there's CAT scans to see, if what exactly the location is. Some people have also have ultrasounds to see how significant the effusion might be for pleural mesothelioma. And then there's also MRIs. There's all sorts of scans, tests, and a whole list of diagnostic tests that are done to be diagnosed with pleural mesothelioma.